Current prenatal diagnostic tools that are of two types, invasive and non-invasive. The invasive tools for prenatal diagnosis are villocentesis, amniocentesis, chodocentesis. Villocentesis is also called villi sampling. It is also called chorionic villi sampling or CVS, which is done in first semester earlier than amniocentesis. We will have a discussion on it the last day of this 10 days course. Then is the chordocentesis. We take sample from the cord, the umbilical cord. These invasive three procedures are offered to women at risk for maternal age, usually above 35 years of age, positive screening test, chromosomal abnormalities, and previous affected child. The non-invasive tests include sorry, ultrasound screening and biochemical screening, low sensitivity and specificity, which is less than 100%. Need to develop new non-invasive prenatal diagnostic tests, which must be simple, easy, least aggressive, least anxious, more sensitive, more specific. The new approaches are fetal cell in maternal blood, free fetal DNA in maternal blood, and free fetal RNA in maternal blood. So from last 20 to 30 years, people are working on it, looking for number of fetal cells in the maternal blood, presence of RNA or DNA in maternal blood. The centered approach to fetal cell isolation from maternal blood, first is sampling, enrichment, followed by analysis. For sampling, we take blood from a vein, which is called venipuncture, as we take blood for other samples for serum testing. The density gradient configuration is done. References are there. The density gradient is centrifugation after treating the sample with Rosette step antibodies. Density gradient centrifugation of cells with density previously modified by non-physiological conditions. The earliest paper was published in 2005. Then is micromanipulation of individual cells, which was done in 1995 and 2002. There are two things. One is FACS, and other important thing is FISH. The FACS is the fluorescence activated cell sorting. So with the help of fluorescence technology, we sort out activated cells. Then is MACS, magnetic activated cell sorting. We use magnetic waves to sort out the cells which are active. Then for analysis, we use PCR, everybody knows about it. And then is the FISH, which is based on fluorescence activity. The scientific evidence have been accumulated to demonstrate the presence of multiple types of fetal cells in maternal blood. So it is proven that there are multiple types of fetal cells present in the maternal blood. Although these cells are few, they have generated interest as a potential source of non-invasive prenatal diagnosis. Now we will see what are the chances and how we can diagnose abnormalities and when we can diagnose in the gestational age by just having 3 ml of blood from the mother.